Professor Richard Parrish and invite him to talk to us on his editorial experiences. Over to you, Dr. Parrish.
Thank you very much. I would like to thank the organizers of the session, specifically those representatives and leaders in the All India Ophthalmological Society that have made this possible. I have already learned much in just chatting with you before the meeting and hope to continue to be a student, not a teacher, for the rest of the meeting. My focus will be developing an understanding of what the American Journal of Ophthalmology wants to publish and focus on what drives the peer review process. These are the goals: to describe the publication goals of the American Journal of Ophthalmology, to tell you what being an author means, not to me, but to the International Council of Medical Journal Editors. I would like to describe an issue that is important in all peer-reviewed publications, and that is defining what is a conflict of interest. I will then compare and contrast the various formats for publication in the AJO. They include editorials, perspectives, original full-length scientific articles, and systematic reviews, and discuss very briefly the principles and mechanics of the AJO review process. I want you all to know that the American Journal of Ophthalmology is not an American Journal of Ophthalmology. I've written an editorial on this subject focusing on our internationality, and our editorial board reflects my perspective that we are one world, one people, and we have one goal for vision. We have editorial board members from Italy, the UK, Brazil, Canada, Costa Rica, New Zealand, Japan, South Korea, Germany, Finland, Israel, Poland, France, India, Singapore, and the People's Republic of China in Hong Kong. It wasn't until I was preparing this lecture that I realized that we have 5 editorial board members, although they are not living in India, all claim proudly Indian ancestries: Dr. Chablani, Dr. Ramalu, Dr. Janji, Dr. Garb, and Dr. Patel. In my opinion, we are all unified to improve vision quality of life by acquiring new knowledge and using it to improve eye care everywhere in the world. Well, this is what the American Journal of Ophthalmology is about. And if you go to www.ajo.com, you will find an explicit description of the AJO. And one word keeps popping up, and that is clinical. Manuscripts dedicated to ophthalmologists and visual science specialists describing clinical investigations, clinical observations, clinically relevant laboratory investigations. I wrote an editorial, what the American Journal of Ophthalmology wants to publish, and if you would like to receive a PDF of that, just email me and I would be happy to send that to you, as well as the other editorial that the American Journal of Ophthalmology is not an American Journal of Ophthalmology. We publish full-length scientific articles, perspectives, editorials, and correspondences. These are really commentaries on published articles, systematic reviews, and meta-analyses, and these are discussed in detail when you go to www.ajo.com. We no longer publish brief reports and case reports. However, they are published in a separate journal that bears the title American Journal of Ophthalmology Case Reports, and Dr. Gupta is a member of that editorial board with Dr. Jay Stewart. We have a new session entitled Illustrations and Insights, which are examples of outstanding videos and visual reports that are edited by Dr. Patel. Well, who is an author anyway? And it's not what I claim it to be. It is clearly defined by the International Committee of medical journal editors, and there are 4 criteria for being an author. You have to substantially contribute to the conception or the design of the work, or acquisition, analysis, interpretation of the data, and you have to draft the work and revise it critically, and you must give final approval of the version to be published, and you must be accountable for all of the aspects that are appropriately related to the accuracy and integrity of the work. And if there's an area that you are not responsible for, then you should be able to identify those co-authors, perhaps those with biostatistical or epidemiologic expertise, so that questions could be referred to them. Well, what is a conflict of interest? And this again is described in great detail in a fact sheet by Elsevier, the publication center of the AJO, as well as at the WWW-ICMJE. And it essentially is any financial or personal interest or belief that could affect the objectivity or inappropriately influence the decision of an editor in determining whether a journal should be published or not. Frankly, if you cannot judge if you have a conflict, then you should declare any intellectual or personal issue and allow the reader of your paper to be the judge whether you have a conflict or not. I am frequently faced with my own conflict of interest. Many members of my faculty at the University of Miami or Bascom Palmer Eye Institute will submit their work, and hopefully their very best work, to the American Journal of Ophthalmology. When I receive that, I forward this to one of my associate editors and state that it's coming from a member of my own department. I can have nothing further to do with the decision-making process. Do with this as you see fit, and essentially whatever they decide, whether it is published or reject, is one that I will abide by. The worst thing would be for readers to think that if you were on the faculty, you had an easy time getting published in the AJO. So, because we have many different types of publications, I would like to focus on, I think, the one which has the greatest interest and impact, and that is the full-length original scientific article. In summary, I ask of every submission, is it new and is it true? So these are the 7 criteria that I have in mind. Do you address a condition that affects the visual system or vision-related quality of life? Do you provide a better understanding of the pathophysiology? Is your information novel, or does it improve our diagnostic ability? Does your information contribute to our therapeutic decision-making? That is, tell us how we can do a better job caring for patients. Or do you provide a better understanding of how we judge or measure treatment outcomes? Do you describe how to improve eye care, not just for individual patients, but for groups of patients or populations? And do you provide information that could more effectively spend the resources on how to improve eye care or visual health? It need not be all of those, but I think at least one of them must be clearly answered so the reader understands the importance of your work. So, you've published your article, you think it meets the criteria that are set forward. Is it new? Is it true? Can you answer yes to these questions? 1, is the information novel, or does it provide important confirmatory information on a controversial topic? 2, do you have a clearly stated reason for doing the study? 3, and this is so important with gigantic databases, did you have a testable hypothesis before you did the study? I cannot help but think now with the availability of enormous databases, it looks like a fishing expedition with all of this data and all of this genetic information. Let's think if there's some association without there being a plausible biologically driven hypothesis. In the United States, did an IRB, or Institutional Review Board, approve the investigation before it started, known as an ethics committee in many portions of the world? Did the authors define what was a measurable outcome before the investigation started? Too often I have the feeling people collect data and then they look and see if the p-value was, less than 0.05 and say, well, it's statistically significant. But it wasn't clear that there was any idea what was a meaningful clinical difference before the study was done. Was there a sample size calculation? Was the sample that you had sufficient to support the conclusion? And naturally, did the methodology support the conclusion? How was treatment assigned? Was it random? And did different groups have different lengths of follow-up? All of these are important criteria in judging the scientific value of a report. When you read the guide for authors at AJO, it's very clearly how it should be presented. And at times I wonder if the authors actually read them. There is a prescribed format for all of the major journals, and they're all a bit different. Most of them have a structured abstract with a purpose, design, methods, result, and conclusions. And at least for the American Journal, we follow the American Medical Association Manual of Style 11th edition for what constitutes how to list the references. It's a small point, but for uniformity, they should be followed. So you've written your paper, you're going to send it off, and you're almost ready to hit send. I would suggest before you press the button send, you ask your most trusted, most knowledgeable, and constructively critical associate to read the manuscript. And when I've done that and someone sends back a note, oh, that was very good, send. I know they didn't read it. I ask them to submit a written review and to make extensive changes with a digital copy and the tracker mode turned on. You learn to be very accepting of criticism in order to improve your work. If you're writing in a language other than English, then asking an experienced English language medical writer to review the grammar and sentence is always important. I say that because I frequently make errors as a Native American English language speaker. I always read my entire manuscript out loud. I want to hear what I have written, and I frequently realize how poorly I have written and how I have failed to communicate what I really wanted to say. In other words, I get in my own way of being clear. Use simple sentences and try to avoid putting too many thoughts in one paragraph. In English, as in I think all Romance languages, there are active verbs, there are passive constructions, and we are taught to always use active verbs when possible and to avoid transitive verbs simply as say using the word there is or is. Well, last slide. Do not interpret rejection of your manuscript as a rejection of you. Before I became the editor-in-chief of AJO, my last two submissions to the AJO were rejected. And one of them had been rejected by Ophthalmology, JAMA Ophthalmology, British Journal of Ophthalmology, and the American Journal of Ophthalmology before it was finally published in OSLI Retina. I still firmly believe that it is the most complete description of the long-term vitreoretinal complications of glaucoma drainage implant surgery. That is my opinion. A second manuscript that actually was the basis for a completed FDA clinical trial was rejected and finally published in the Journal of Ophthalmology. I would tell every author to remember that you know what is important, even if the reviewers do not fully accept your opinion, and do not let their rejection stand in your way of getting a work published. As we say in this country, in America, that cream always rises to the top. I would wish you good luck as you proceed with your research, a late great American basketball coach who died of complications of cancer shortly before his death, when talking about his own struggle with cancer, so passionately said, "Never give up, never ever give up." Thank you.
Thank you, Dr. Parrish. I think it was a good insight into how you would approach a manuscript when you're reviewing it. What are the basics questions you also need to ask yourself when you're looking at every submission which has reached your desk? I think it's also important for the authors that they also have a similar checklist on their minds when they are preparing their manuscript. So it makes it easier for them to enhance the way they write their manuscripts, and it also becomes easier for us to look for those answers for those key questions which we are looking at when we are thinking about making a decision of whether to move this further from the main editorial desk into the desks of associate editors, and then they to move it into the desks of their reviewers. So I think that was a very good insight into what would be the key points which you would look for look in every manuscript when you want to move it further into the reviewing process here. I would invite my panel to put forward. Yeah, before that, I think, yes, Dr. Raj. Yeah, please do introduce yourself as well. And
yeah, I'm Dr. Raja Narayanan. I'm a retina surgeon from LV Prasada Institute.
Can we have the mic up, sound up, please,
Yeah,
for the mic? Yeah.
I hope I'm audible now.
You
Thank
are,
you so
yes.
much for the kind of personalized talk that Parrish has given us. I feel very fortunate. One of the common problems that we all face is the different style or format for different journals, and that can sometimes feel so it takes so much time that you know it's my question with concerning to that is, would it help to email the editor-in-chief for an inquiry that whether you would be interested in sending out a manuscript for review before we format, and that takes a lot of time. So does that help to ask an editor-in-chief before it's sent out for review?
Your question, let's see. There we go. Your question is important, and just to review for those who might not have heard, is it because it is so much effort to prepare a paper and to format it based on each journal's criteria, is it worth sending a letter to the editor-in-chief asking them to essentially pre-review the topic? I received this question many times. It has been the tradition of the American Journal of Ophthalmology not to pre-review. And you say, well, why not? I know this will be hard for some members to believe, but today I reviewed the 823rd submission, calendar year 2025. We will have over 3,000, well, right now it's on track about 2,800 submissions. And although it's a great idea, I simply don't have the bandwidth or the time. When I receive, I need to make a decision, as was just mentioned, whether to send it on to one of the associate editors, who will then send it on to two of the reviewers. Again, if you focus on the editorial, what the American Journal of Ophthalmology wants to publish, I think it's pretty clear whether you think it will meet those criteria. I can't guarantee it will be reviewed, but I would strongly suggest reviewing that. And again, I'd be happy to send a PDF of that editorial to anyone who likes to see it.
Thank you.
Yes, Dr. Rohit.
I'm Dr. Rohit, and I just wanted to ask you that most of our papers we write from our team has a mix of the biology and the clinics. And many times, for example, wound healing in cornea and also some of the retinal stuff. So many times we have received that this is not suitable for this kind of a journal and probably submit. Is that something which I should keep in mind, that see, most of the biology, the translational ones do not have, it's more of strong hypothesis, and there are a lot of experiments which give some kind of a proof, and it's very difficult to have a concrete conclusion that this, like you said, the transitive verbs like this and it. So do you think that these kind of papers should not be something which is on the top of our list when we submit? Thank you, and thank you for a great talk.
Thank you. The question is, when there's a mixture of biology and clinical information, how do you judge whether it's a good fit for the journal? And I don't have an easy answer for that. There are so many excellent peer-reviewed journals. There is now TVST, Transitional Visual Science and Technology, which is an excellent journal as well. It's part of the ARVO family of publications. I think it still gets back to, and it's blurred, it's pretty clear all of the three major English language journals based in the United States anyway, that's JAMA Ophthalmology, Ophthalmology, and AJO, are all dying to receive the latest randomized clinical trial which will definitively show a result. If we only published randomized clinical trials, there might be one journal every 3 years. I mean, there's just not a lot of that kind of information. And I have learned to depend on my editorial board. As you see, I have editorial board members from across the world. And if there's something that comes in on retina, for example, and it deals with some aspect of macular degeneration or treatment, we have the good fortune of having Dr. Tablani, Dr. Stewart, Dr. Philip Rosenfeld. If we have something that deals with uveitis, we have Dr. Janet Davis, Dr. Nita Sen, Dr. Lucia Sobrin, and the list goes on and on. So as an editor-in-chief, I think the single most important thing I can do is to assure that the members of the board are thoughtful, constructive, and honest in their opinions. So I'm afraid I've managed to avoid answering the question other than to say I trust my members of the board to help know what combination of basic science or biology and clinical results are justifying publication.
Dr. Parrish, we do have a lot of articles which are available on preprint now, online. And I do see an increasing trend of authors wanting to have their articles on preprint before they would probably submit it for peer-reviewed journals here. What is your take on that, and would you really consider the article further if you have something which is on preprint, which is being submitted? Because in IJO, we as a policy do not encourage those which are on preprint, which are already available for the audience to read. We do have a policy on that. What is your take on this?
The question is on preprint, so something might be available at an open access site. I think at this point we now go from science, at least in the United States, to a legal definition. Elsevier is the publisher of the American Journal of Ophthalmology as well as Ophthalmology. And I know there are strict, enforceable international legal rules. I would have no problem with that. But I know that the publishers jealously guard what is copyright protected and not. I mean, this other issue has come up in the past. People would go to a meeting like this, listen to a presentation on a brand new concept, run back and publish it in a non-peer-reviewed journal, and there was a great deal of conflict as a speaker. You know, did you contribute to violation of a copyright? This was at the American Academy, because the American Academy has the first right of refusal for anything printed or presented either at the podium or poster. So I guess at this point it is still, my understanding, forbidden by Elsevier.
I have one question regarding being on the editorial board. I mean, how easy or difficult do you find to find reviewers? Because over the years we've been having a great struggle just to find reviewers. Sometimes they're very good papers and you don't get reviewers for them. So how do you manage this?
this is one of the most important questions that I face. There are so many very, very specific topics where only a handful of people really know the information, whether it's some aspect of ocular surface or trabecular meshwork biology or imaging of the retina. And it's hard once you get outside of a very small circle of individuals to find an expert. And unfortunately, and this has happened to me with one of my own members of my faculty in Miami, is this individual is a world-class clinician scientist. And I've asked this individual to join the editorial board numerous times, but they have declined. I'm very busy. But yet, when it comes time for them to send an article, they send it to the HAO. And I said, come on, we're spending many hours reviewing your work, which is excellent. Couldn't you think about helping us review and be fair? And it's a struggle, as you all know, although I'm provided a modest honorarium for being the editor-in-chief. It's not a full-time job. Every reviewer who takes time away from their clinical practice, from their own research, from helping members teaching in their society or in their medical school, it costs them something, and it's so unfair. I mean, I am most grateful to all of the members of the editorial board. I was able to have silk ties, and they're made in India that have the AJO, and I gave that to the male, the men, and I have a scarf, a silk scarf, again made in India for the women who are members of the board. But it's not enough.
No, it's not enough, yeah. I think that's a constant concern which all of us are facing here, and it is indeed, I do concur with you. The same thoughts which I had. I have all the leading institutes, the academic institutes from India who contribute a lot in terms of their submissions to Indian Journal of Ophthalmology, but I have the same problem when I do approach them to review some papers. As you see, we know that there are only a specific few who are academically probably sound in terms of their knowledge in addressing the concerns of certain submissions, and it is still unfortunate, but we would probably still keep sending out our requests and asking us to join them as reviewers to our team here.
So I think I found one small trick. So when in my institute people come to me and ask me, it's been a long time that we have submitted in the journal and we haven't heard from them, then I put forth the question, are you willing to review an article? Can I send you one? And if they say yes, then I tell them, oh yeah, then I'm sure you will get yours soon. So that's one trick that I'm trying to apply. Well, I have a question for you, Dr. Parrish. In your journal, how do you keep a balance between the scientific or the basic research and the clinical articles that come? Is there a way in which you are trying to balance it out? Because each requires the other.
Yeah, I mean, this is, you can't have good science or you can't have a clinically important concept that improves patient care or our diagnostic ability unless it's based on good science. And what is that balance? And again, I trust the editorial board members to make that decision. We, as you know, in the FDA, the Food and Drug Administration, and hopefully it will continue as it has been in the past, there are these very basic phase 1 studies, phase 2, phase 3, and the ones that finally lead to approval of a drug. Traditionally, it's only been the phase 3 studies, the ones that lead to final drug or device approval that get published. I have spoken to several individuals and said, well, listen, if you have a phase 2 trial that shows there's enough information to lead to phase 3, I will take a gamble. I will publish your phase 2 with the understanding if you do go forward with a randomized clinical trial authorized by the FDA, I would hope and anticipate you would give us that first right of refusal. And so again, some of the very, very basic science work, which is terribly important, that gives us some understanding of a disease process, but the connection between that and ultimate treatment is too far away. I think investigative ophthalmology, visual science, Journal of Vision, and TVST are all options. It's not, again, it's not that they're not of value, it's do they fit in with my notion of how it improves clinical care. And that's a very nuanced, highly subjective decision. And frankly, we always don't get it right. I must tell you, and I think if he were here, he would let me know it as well. Arguably one of the most important advances in the treatment of neovascular age-related macular degeneration is the use of anti-VEGF treatment. And the first individual that I'm aware of who sent a publication or an article for review was Dr. Rosenfeld from my own institution. He reminds me constantly that was sent to the American Journal of Ophthalmology where it was rejected. So we all make mistakes. We don't have perfect vision. And, obviously he did not say, oh, I guess it's of no value, let me stop. As a result of his persistence, it's changed the life, I think, of hundreds of thousands, maybe millions of people with what would otherwise be a blinding condition across the world.
Dr. Rohan, yeah.
Very nice talk, Dr. Richard. You have nicely outlined what all articles you would like for submission to American Journal. So there's a recent trend here that people have now started doing online surveys and sort of making articles based on that. So I just wanted to ask you, what is your opinion regarding that?
Yeah. This is a great question, and that is, what are the value of survey-type publications? And I must admit, I have my name associated with several of them. There was a survey, and I think it's been in three different generations, and it was an inquiry originally of the Japanese Glaucoma Society, the American Glaucoma Society, and this was maybe 15 or 20 years ago on the use of antimetabolites like 5-fluorouracil or mitomycin. And, it was published, and that we've done some additional ones. The problem in almost every survey is poor survey response rate. If you're going to publish something that is presumably reflective of a society, you want to do the All India Academy use of whatever, anti-VEGF in neovascular AMD, and I'm not sure how many thousand members of your society, but I'm sure many. And if you have a response rate of 20 or 25%, it becomes very difficult to believe that that information would be generalizable to the whole group. So the very weak spot of literally every survey is a poor response rate, because at the end of the day, you don't know whether people who really like it respond or really hate it and they don't respond. And it's one of the main problems.
Yeah, actually recently we had a similar survey from Vitreoretinal Society of India, which has thousands of members, but you're right, the response rate was about 350 or 400 odd members. So I also said that the response rate is low, so probably we would not like to accept that article.
It's also hard to know how to go forward with that information, Are you trying to sell the people who didn't respond, they don't know what they're doing? No, of course not. This is simply what it reflects the practice.
Yeah. So I think we have both Dr. Thomas Conan, he's Dr. Frank Larkin, and Professor Radhika Tandon, who's also joining us. Please join us on the dais, ma'am.
So, Dr. Parrish, I had another question about the AI devices or the apps that are being used now. A lot of authors have been taking the help of the AI devices. Till language correction probably, or the grammatical aspect, I think everybody is okay with it. But is there any other way in which the AGO has been working to pick up?
Yeah, the question is now on the ubiquitous appearance of AI, and where is the line?
Exactly.
Where is, running a spell check, because even in English I make grammatical errors and spelling errors all the time. I don't think anyone would, we've had spell checks forever, so that's not important. Trying to rewrite something using AI, at what point is it no longer yours? And this is very blurred. There was an editorial, I think, that has been published by Elsevier on that. Generally speaking, the less it's used, the better. Because I'm still not sure. Sometimes I think the only thing that's artificial about intelligence is that it is artificial.
I think Dr. Radhika has a question.
Yeah, I was just wondering that over time we will have to change the paradigm. So if these AI language tools can improve efficiency and give a different dimension, so can we be a little bit flexible and allow the person to declare? So it may not be the original work that that the device or sort of the tool has created. But it could assist, in organizing things and, putting things in a better way. So can we think about in future having a little bit of flexibility and then having some rules that you declare that you have used it for ABC?
Yeah, the point it's made, it's excellent. Can we use AI to improve the work that we've done? Although it would be a real nuisance, I think it would be great to say, send me your publication pre-AI, send me your publication post-AI, and if a paragraph is rearranged or thoughts are turned around so that it's more clear, I have no problem. But if it changes fundamentally the concept or the approach, I think we need to be flexible. This is the real world, and there isn't anything that's developing in AI that has been untouched by AI going forward.
Thank you.
I think we have Dr. Frank Larkin also join us. And I think this is a question for both Dr. Larkin and Dr. Parrish. What do you use as strategies to detect the amount of AI the authors use in their manuscripts, apart from language correction? Now, I do find Indian Journal of Ophthalmology has a lot of submissions coming from non-English speaking nations such as China. I think you must also be facing the same. And sometimes when we read those manuscripts, we know that they have been manicured using artificial intelligence. And I am at a loss to really see how I can incorporate an AI detecting software. So what would you advise us, and how would you think we can take this problem further?
I think at the end of the day, if something doesn't have sufficient scientific merit or structure, all the amount of AI in the world is not going to turn something that is not of high quality into high quality. So I must admit, I have not found it to be a problem, because the good science will bleed through. It either is or is not. And you can only polish, a rock will never be a diamond no matter how many times you try to polish it.
I would absolutely agree with that. The authors submitting to our journal, which is published by British Medical Journal, they fill in a declaration, and there are other subsidiary declarations at the time of submission, but it doesn't matter at all at the editorial level, exactly as Dr. Parrish has said, because if it's rubbish, it doesn't matter if it's rubbish generated by AI or by the authors. And the key thing for the editor is to decide what's good enough, and then go into the detail about why it's good or why it might be made better and how it might be made acceptable for publication. So the declaration for the authors is their business, but we've got to go deeper than that.
I have a question, if I may ask. There's another challenge that we're facing as authors nowadays, that over the last 2-3 years there has been open source or open access publications, and we are still using the metric of citation as our benchmark for whether the paper is good or not. And sometimes these open access journals, somehow they have a much higher, the journal will have a much higher index factor, impact factor. So do we need to redefine keeping this concept? Because now we're a little confused as to which journal would be considered a better kind of a higher ranking journal, because sometimes the higher ranking journal then is open access, and then it's extremely expensive, like it's prohibitively expensive, sometimes even over $1,000. So that's the only thing we're wondering, that do we need to rethink as to how we rank the journals, or put it as which is better than the other? Is there any new metric that we can think of?
I don't think that open access journals in ophthalmology have very high impact factors. There are obviously several of them, and that number will, I'm certain, grow. But the journals such as the journal edited by Dr. Parrish, myself, JAMA Ophthalmology, Ophthalmology. These are journals which publish open access on payment, but the fully open access journals, they've got low impact factors as things stand.
Changing now, it's changing.
Well, it's not.
That's the trouble.
The open access, in fact, have significantly high impact factor than the journals like the IOVS, if you take for example, has a significantly high impact factor. They all go for double-digit numbers.
But that's not open access only, is it?
I think so. It's open access. If I might be wrong, I'm not sure about that.
Yeah, I think it's a little confusing. Impact factor is, I believe, a proprietary metric owned by Thomson Reuters, and it refers to if you have published an article, how many times that article was quoted in a peer-reviewed journal, not in an open access journal, I believe. And so everybody is trying to publish and have someone pick it up and have it cited in that regard. But I think that's almost always limited to those peer-reviewed journals that Dr. Martin just mentioned.